Welcome to the Motivational Midwife. My name's Lynn Jones, and today we're going to look at evidence-based practice and professional values, particularly in relation to the NMC Osce. So evidence-based practice and professional values. I was asked to put this session together by an international candidate who emailed me and asked if I could put one of these small videos together specifically on the silent stations for them for their OSCI, which is these two areas. But actually, although this will be specifically aimed at their OSCI process, the evidence within this is relevant to all of us as practitioners. So please don't just think it's for the OSCI, NMC Osce candidates. It really is for all of us, whether you're a student or a nurse or a midwife. So from an OSCI perspective, the silent stations are two stations. They're 10 minutes each, and you'll have one on evidence-based practice and one on professional values. So when we're looking at professional values, what are they? So this is linked to the code. Okay, so the code is what we are judged against. It's essentially our book of rules that we work within as nurses and midwives and nursing associates. We have to, if we were referred to the NMC, the pillars of the code are what we would be benchmarked against to see if we have breached any of those 4 pillars and what's within them. So if you haven't read the code, I would really seriously advise you to look at the code and take each one of those pillars and write yourself some notes that you understand what that section means for you. So what does prioritise people mean? What does practice effectively mean? What does preserve safety mean? How are you going to promote professionalism and trust? Write yourself some notes for that you can quickly remember, because you've only got 10 minutes when you're writing, and you need to be able to demonstrate that you do have that working knowledge of the code. If we look at some of them in a little bit more detail, they cover things like treating people as individuals and upholding their dignity. And a little bit later, when we start looking at the marking criteria, you will see that you need to try and get that within your answer. How are you going to do that? How are you going to uphold their dignity? Listen to people and respond to their preferences. Now, people may not like your advice, and within the code it actually does say that as nurses and midwives, our role is to give people evidence-based information to make an informed choice, but they are quite at liberty to decline our advice. And as long as you have given them the most current evidence-based information that you can find relating to whatever it is that you're discussing with them, that is their right to decline it. Your role then would be to document very carefully exactly what you have discussed with them, the information you have given them, and their choice to decline that, and the possible implications of declining it. But it is their choice. And we may not, or certainly for pregnant women, we may not always like women's choices. We may not always agree with them, but it is their choice. That we are looking to make sure that we've met people's physical, social and psychological needs. So within this one, it's, do we need to refer to other agencies? It's part of multidisciplinary working. Are there other agencies? Perhaps children's social care, perhaps health visitors, perhaps GPs, physiotherapists, doctors, obstetricians. Is there other mental health services is there other agencies that we need to liaise with to ensure that we have met the physical, social and psychological needs of our clients. And although the code refers to everybody as patients, because remember the code is for nurses and nursing associates as well as us as midwives, most of us wouldn't necessarily refer to the women as patients, although to be fair, I do, because it's kind of, I was a nurse before I was a midwife, so it's very difficult to get out of that habit. But they're generally, by and large, are fit, healthy women, so they're not really patients, they're clients. But we must act in the best interests of people at all times, and this one comes into being a lot more in your emergency situations, particularly if you have a situation where the woman perhaps is not able to make those decisions for herself. Respect people's right to privacy and confidentiality. So breaching confidentiality is a very serious thing, and so you have to be mindful about who you discuss or who you send women's personal details or concerns to. You know, there's a need to know. So, you know, don't discuss people you've cared for in public areas, in lifts, even within a hospital setting, because you don't know who's listening. You really need to be very mindful of people's privacy and confidentiality. And also when you're talking to clients, you know, is the 4-bedded bay an appropriate place to be talking to them? Because curtains do not stop sound travelling, so people in other beds may well hear your conversation. And then for us as professionals, we need to always practice in line with the best available evidence. And if you go on the NMC website, you will see that you get this page up, which has the code on it, and you can download the code. But if you scroll right down to the bottom of the page, you will see these little videos here. So if you're like me and you're much more of a visual learner, you may find that these videos are much more helpful in helping you really put the code into some sort of tangible way that you can work with it. So what does it mean to be accountable about delegation? Certainly when you're doing your skills stations, your emergency skills stations, you will be delegating. So are you delegating appropriately? Are you delegating to people who have the skills to do what you are asking them to do? So these little videos are quite useful, and you can click on those right at the bottom of the page on the code. So are they important? Yes, they are. As I've said, we have to work within the code. And it relates to professional behaviours. So even when we are not at work, we have to uphold our profession. So that's quite difficult for some people to really get their head around, that when you're not at work, you're still a professional, you're still a nurse or a midwife, and therefore you have to behave professionally. So actually, you know, being drunk and getting involved in brawls and shouting matches and things is not professional behaviours. And certainly if I just go back to that previous screen, you can see there's one here on social media. So you need to be extremely careful about what you post on social media, particularly if you have posted that you are a nurse or a midwife in your profile. Again, it's upholding our profession. So in relation to professional values, you have to incorporate those professional values in every single station of the OSCI. It's not just the written silent stations. Okay, so for the professional values within the OSCI setting, you will either get potentially a safeguarding scenario or a bereavement scenario. And they link very much to 16 and 20 of the code. So one about acting with delay if you believe there's a risk to patient safety or public protection. So it's very much with your safeguarding here, isn't it? And upholding the reputation of your profession, which is what I've just said about, you know, at all times you need to uphold the reputation of your profession. So this is the example that's in the mock OSCI that the NMC give you. So it's a postnatal ward scenario of a preterm twin delivery, and she's now coming in to sort of day 2, and the babies are doing well, but she's pressed her call bell and she's very upset and angry. She feels pressurized into expressing breast milk for the babies, and she doesn't want to carry on, but her husband is really upset because he's concerned that they need that expressed breast milk due to their early age. So when we're looking at that, how are we going to meet the marking criteria, but also demonstrate that we've met the code, that we've showed how we can do the code, how we can use the codes, and how we are actually embodying the code when we answer that. So the specific marking criteria for this example is respecting her privacy and dignity. So you're going to write that you will respect her privacy and dignity. And how are you going to do that? So again, if she's in a 4-bedded bay, you might actually take her to a room that's more private where you can discuss that. Discuss with her concerns. What is it about expressing? Is it just that she's really tired? You know, you can discuss with him as well what his concerns are. This is links very nicely to the listening to your patients, okay, listening to your clients. You need to advocate for her. Part of your role as a midwife is to be an advocate, and therefore you're going to have that discussion with him that whilst you absolutely recognise that breastfeeding is better for babies, that actually that may not be for her at this point in time, and that ultimately it is her decision, not his. So you need to advocate for her, but you could discuss some options with her. You know, there's plenty of different options that could help her, depending what her specific concerns are. And recognise her situation. So think about, you know, act with kindness and compassion. So within our NMC code, we also link quite nicely to the 6 C's of the NHS. So caring and compassion and all of those other C's. So marking criteria generally for professional values. The first one is about building, relationship building. So you know, you might start, I will build a trusting and respectful relationship with, if there's a name within your scenario, whoever that is. And how are you going to do that? And act in her best interests at all times. So how are you going to do that? So I'm going to do that by giving her clear, balanced information, evidence-based information to allow her to make an informed choice. I'm going to develop an individual care plan that is holistic and that will cover her psychological, social and physical needs. I'm going to be respectful and empathetic and try wherever possible to provide continuity of care and carer. I'm going to be an advocate for her. And I'm going to liaise with my multidisciplinary team. So again, mentioning, depending what your scenario is, which particular members of the team you might be liaising with. And I'm going to recognise this particular person's individual circumstances and how they might impact on her transition to parenthood. So it isn't just a case of learning the marking criteria and writing those out, but remember, you only have 10 minutes. So for each marking criteria, you can write the marking criteria, but then add extra to it specific to your scenario that you've been given. So moving on to the evidence-based practice. So evidence-based practice is designed to test your understanding of reviewing medical information or scientific papers and research and trying to interpret that and relate it to the care you're giving. So it is showing that you need to relate it to your practice. So it has to be relevant to practice. It has to be current. It's no good giving women or digging up evidence that is 30 years old, because it may be well out of date. Now, it might be that the evidence that you're presented with is quite dated, the paper they give you to look at, and therefore it is appropriate that you recognise that this is quite a dated paper, and in your answer that you write, I will inform her that this paper is quite old and there may be more current evidence that she can access, and I will signpost her to those resources. So for your silent station, you're likely to either get induction of labour or place of birth. So the mock example they give you is on obstetric anal sphincter injury, so OAC. And it's your scenario that you've been given is that you've got an appointment with Hannah. She's 36 weeks with her second baby. She had a von twos delivery last time, and she's obviously quite concerned about preventing perineal trauma. So she quite likely had some perineal trauma with her previous birth. And she's wanting to talk to you about that manual protection of the perineum. So hands-on. More hands-on delivery, use of warm compresses. This is where you need to have read the research so you know what the key points are. So in this mock example, they do actually give you a small study. So they're talking about this 2010 study. So if we look at that, that's actually 13 years old. So it really is quite a dated study now, but it was quite a large study. And I've highlighted some of the key points because you're not going to be able to write all the key points down. So you really just need to be highlighting one or two key things that you can get into your answer. So the key things here is that with that manual support of the perineum at the end of the second stage, there was a significant reduction in the third and fourth degree tears. So those more severe tears. And that you have to recognise that there were variables within that study. So some hospitals had more episiotomy rates or more modes of delivery, and delivery parity was different. So there were a lot of variables within that. So what they're asking you to do is really comment on how good is this evidence. And so in order to be able to understand that, you do need to understand a little bit about research and the hierarchy of evidence. And if you haven't done that, I certainly would Google hierarchy of evidence so that you can understand which types of evidence are actually more significant than others. Okay, so for this mock OSCI, your marking criteria is asking you to summarise the main findings from that article and draw some conclusions. Okay, so you're not necessarily going to start your sentence with the summary, but you're going to weave your summary within your answer, or that's how I would do it. And then you recognise and make reference to women's-centred care and her choice. Okay, regardless of what the national recommendations are or regardless of what the evidence says. So this is going back to the code as well, around our job being to give her evidence-based information, and that's to allow her to make an informed choice about what she wants. You need to recognise that she may be anxious about her previous delivery and perineal trauma. Okay, so you're going to inform her that the results of the study did show a reduction in that severe 3rd and 4th degree tears or injury, both in sort of forceps and ventouse and also spontaneous births. But recognising, say, you've acknowledged that this is an old study, that there might be more up-to-date information, and that there were variables in that, so that could affect those results. So your marking criteria generally for your evidence-based practice, again, is these are very similar to the professional values. So you may start your sentence with, I recognise the importance of building a trusting and respectful relationship with Hannah, or whatever your scenario gives, working in her best interests at all time. And I'm going to do that by giving her clear, balanced, evidence-based information, discussing the risks and benefits of the information I'm giving her. And depending what your topic is, so if your topic is induction of labour, you're going to be talking to her about the process for induction of labour, about what the evidence says about prolonging pregnancy and the risks to her and the baby, but also recognising that there are also risks and benefits to induction as well, so that she can make an informed choice. If it was a place of birth, then I would suggest that you definitely, there is a module on the electronic library for health, which I'll talk to you a bit about in a moment, and that is useful to do because it will give you some key informatics that will give you some key information around things like transfer rates from home birth into hospital, which differ for multips and primates. And so you can summarise those information. I mean, and some of the key information around home birth is that generally, although again, the place of birth study is really quite old now, but generally home birth is safe for low risk pregnancies. There's about an incidence of 4.3 per thousand poor outcomes. Okay, your transfer rate for primates is about 45%. Your transfer rate into hospital for multips is about 10%. So if your article is, or your scenario is a primate, then you're not going to give her the information about transfer rates for multips because that's not relevant to her. You need to give her the key information that is relevant for primates. And likewise, if it was a multip, you're going to give her the key information that is relevant for a multip. You'll recognise, depending on your scenario, how those individual circumstances are going to affect her transition to parenthood and bonding with her baby, her family attachments. And again, you're going to advocate for her to support her choices. So you're going to write, you know, I recognise that I'm going to advocate for her and work with the multidisciplinary team. So that might involve organising an appointment with the obstetrician to discuss her options further. It may well be liaising with consultant midwives, GPs, health visitors. There are a lot of people that you could liaise with. So try and be specific in the types of people within that team that you are going to liaise with, just to show that you are not really just writing out the marking criteria. And that you recognise that you are going to try and provide individualised care that will optimise physiology. So that may mean more frequent visits, depending on what your scenario is. So, read more widely. Okay, it is not enough to just write your marking criteria. If you really want to demonstrate that you have a knowledge of both the code and research, you need to read more widely. So the electronic library for health, if you are over here already, you will have an NHS email address, and therefore you will be able to register on that electronic library for health. And I will put a link in the description box below. There is resources on there for induction of labour, for place of birth, for safeguarding. There is a number of resources on there that you can access and also make notes for yourself. So little key points, because remember, you only have 10 minutes to write this. If you're not doing it for an OSCI, then obviously you can make notes for yourself, and that would be great for students that may be watching this. Then obviously you can utilise these resources for your essays and written work that you may be doing. And you need to remember, this is practice in the UK, so whatever you're doing in your own countries, it's not that it is irrelevant, but you are trying to demonstrate UK practice. Now that may vary from what you do in your own country, and I know from my own overseas students there are differences between what we do in this country and what they do in their countries. Have an understanding of what good research is. So this is really about looking at that hierarchy of evidence, what makes a good piece of research, what makes research transferable. Have a look for yourself. So with induction of labour, maybe have a look. Is there anything that's more up to date than the evidence that you're presented with? And often there isn't. Often there isn't anything that's been put in that is more recent than 10 years ago. The Cochrane database is an excellent resource for research papers, and if you Google Cochrane database, and again I'll put a link in the description box, or you can go to the library within your own trust, and the librarians, who are fantastic people, will help you find the Cochrane database and how to access current research. And really importantly, read the code and your standards for proficiency for midwives. So the standards for proficiency for midwives are what we are all expected to be able to do as a midwife, and the training of 3-year students, the BSc students, and the shortened course students is very much linked to those standards for proficiency. And finally, good luck. And there you have it, a quick look at evidence-based practice and professional values. I hope you go and read more widely. If you haven't subscribed to the channel, please do so, and please encourage your friends to subscribe. I look forward to seeing you next time.